One of the biggest things impacting all of Pennsylvanians and arguably all of America is our health care. Right? We were hearing about the Medicare cuts, the Medicaid cuts from the Trump administration. What are we doing at the state level to protect our health care, keep our hospitals open, and filling in the gaps? And again, providing a path forward when there's chaos.
Yeah. I'm going to go first again. Sorry about that. Yeah. Well, that's true. This is home field advantage. Just this term, we finally got done a piece of legislation that actually has broad bipartisan support in the House. Representative Lisa Borowski and I introduced a piece of legislation called the Healthcare Facilities Protection Act, which will amend and allow additional protections for communities to guard against consolidation and closures of healthcare facilities. What we're seeing all over the state is private equity and private corporations and, quite frankly, nonprofits that act just like them, like UPMC, by the way, which, believe it or not, is a nonprofit, come in and consolidate and then close down facilities. And it takes doctors offline, it takes facilities offline. There's a 7-county area in the northwestern part of this Commonwealth that has no OBGYN or maternity services. You cannot have a baby. The closest place to go have a baby in many cases is to drive over the border into Olean, New York, which is ridiculous. It's absurd. So this just provides additional protections. I believe 14 different healthcare facilities have closed in the last couple years. Every damn one of them was like a private equity takeover to increase profits, give money back to shareholders, not to help the communities, not to help the providers. And by the way, these non-compete agreements, many of those same providers are absolutely locked in. They can't go to work for someone else. So we're trying to fight on that front, but please call and urge your senator to have them take up the Healthcare Facilities Protection Act. It's House Bill 2344. Super important, and I believe we can get it done because it's just the right thing to do.
I'm proud to be working with Representative Takac as a co-prime sponsor on that bill, and Representative Borowski was, and another reason why I ran with Hahnemann closed, and they, all those nurses, Hahnemann, where Grace Kelly was born, 171-year old hospital, private equity, they bought it, and they separated the land from the institution. So that bill will help to prevent our community hospitals from being targets of for-profit, private equity, coming into our communities, buying up the hospital, separating the land from the institution so that they can load up the hospital with bad debt and then sell the land as real estate. That is what they're doing. That is the craziness that is happening. And it is what we are doing in the House, this Democratic House, to actually stop that from happening, to allow the Attorney General to stop that from happening. Something that there's been a lot of chaos. We had a town hall with Senator Sharif about this in Washington. One of the things you may have missed, may not have missed, that they voted and they passed, and Donald Trump signed into law a bill that will take away health care insurance from 300,000 Pennsylvanians. 300,000 Pennsylvanians will lose their health care insurance, and just on Medicaid alone. And they thought they were being sneaky because they think you're stupid, and they actually did it so that it would happen after the midterm election. So people would think that the Democrats did it. They think because they think you're stupid. That's what they did. And so I'm proud that I worked actually with Representative Eddie Day Pashinski, who is leading this ACA protection bill. Representative Takac, who's also leading one of these bills, that will start to codify the Affordable Care Act to help keep some of those protections in order. That do you know about pre-existing conditions, and that health insurance companies can't discriminate if you have a pre-existing condition because of the Affordable Care Act? Well, our bill would actually protect those pre-existing conditions so that they can't repeal that. Why? Because the insurance companies will be able to deny anyone, if you had a stub toe, yeast infection, if you had a splinter, they can deny it as a pre-existing condition. Anxiety, that's what they do. That's the games that they take away the rights for you to get health care insurance so they can make more money. We have kids under age 26 to stay on their parents' health care. That was enshrined in the Affordable Care Act. We have a bill that will codify that, will protect that. Preventive health care. So if you have health insurance companies have to make sure they pay for when you see your primary care. They have to pay for colonoscopies. This preventative health care service is enshrined in the Affordable Care Act. Again, it's at risk for being overturned. That's another thing that our bill would protect. So we are, one by one, working to protect the areas of the Affordable Care Act, to protect you, to protect Americans. Because, again, this is about protecting people, not looking out for private equity, looking out for the donors. That is not the priority of the Democratic Party. That's not the priority of this House Democratic majority. What we are fighting for is people. We're fighting to keep things affordable. We're fighting to help people keep their health insurance. That's what you care about. That's what we're fighting for in the House. Thank you.
So I just want to talk about something that's happening locally, which I think is really important, and especially as we're talking about closing or closed hospital facilities that are shutting down access to certain kinds of care. I have a facility in my district, Suburban General, that was a mothballed hospital facility, and because of the vision of he's a urologist who ran the Allegheny Health Network, and this is sort of his retirement project, where he said to Highmark of just give me Suburban General and get out of my way. He has taken that facility and turned it into a healthcare company incubator. And so he's taking areas of the hospital, using labor that exists working for the hospital, the maintenance folks that already work there, to redo some of the facilities and make them available as labs, as testing areas for people to develop healthcare related devices. And this incubator, this has been 4 years that this has existed. This incubator is top 10 in the nation in terms of producing companies. And they've taken this facility from being a $3 to $4 million a year liability to paying for itself, and it's not even full yet. So in many ways, this is a fantastic example of how it is that we can use these facilities, because what often prevents small companies that are trying to get into the healthcare space in particular from being able to do that is access to what they call wet lab space. And what wet lab space is, for anybody who doesn't know, and I didn't know, and I learned this, is hospital grade research facility. So if you are using a hospital facility, you inherently already have that. And he's able to rent out square feet in a wet lab space for $15 a square foot, when normally that's going for $300 a square foot. And it makes it much more accessible to these startup companies. And now, because of the work that they have done to bring businesses in that are paying rent, they are now actually reopened to provide medical care to the community. And I think that is a model that we should be looking at to encourage and package and bring to communities where we are seeing closed and closing facilities. To one, this is a great way to bring businesses into areas. It's a great way to provide jobs for folks. And it is a great way to ensure that people continue to have access to essential healthcare services.
3 hospitals, 2 of which are going to close. And in Wilkes-Barre, we have the General. We've already lost the Nesbitt, we lost the Mercy, And the General was the hospital that everyone went to. And there was collaboration between Wilkes-Barre and Scranton for many years. They worked together. Now you have all these hospitals that are now going to close. The population has increased. Why are they closing? They're not making enough money. Well, I thought hospitals were supposed to provide health care. All right? There are two things you want to keep in mind. What are the things that we need to survive in life? Well, we need some utilities, water, electricity. We need that doctor. We need that vaccination. We need that nurse. We need that care when we're sick, right? We're willing to pay for that care. About your children, your grandchildren, your own future, you got to come out. Don't you hesitate to reach out to any of us anytime. You have a question, we'll do our best to try to answer that, okay? But we need you. You're the Army, Navy, Marines, Air Force, and Coast Guard for democracy, for the Constitution, for your freedoms. And with that, thank you. I'm late for another meeting. Can I be excused? This will run a little quicker now. Love you guys. Thank you.
Yeah, thank you, Chairman. I just wanted to mention real quickly, just super headlines. We're also looking at things like expanding advanced care practice so that we can get more nurse practitioners and other advanced providers to provide more services, telehealth services, and we're working to attract and retain workforce, making it more affordable, tax incentives, those kind of things, particularly in rural communities. So if any of those are of interest to you or you think would help, please reach out to one of us because we're working on that legislation as well.